everyone. This is the Upward Spiral podcast and our very first episode, the pilot, so to speak. I have Dr. Gina Marie Papilla, my co-host, and I am Dr. Michael Foti. So why don't we just introduce ourselves, G? Let's start with that.
Okay. I guess
Go
I'll
ahead,
go first and then I'll toss it back to you. I
please,
am
please,
Dr.
please.
Gina Marie Papilla. I am an osteopathic physician, integrative medicine doctor, and I am currently practicing in New York. I am active on social media, I'm starting my own virtual telemedicine practice, a lot of stuff going on. I'm also an advocate for overall health and wellness and, being the best you can be and being vital and living your life to the best ability possible. That was long-winded. I'm going to pass it back to you, Dr. Foti.
And that's our commonality is the
Yep.
wellness aspect, and that's why we created this podcast, right? I think that's we're going to be bringing so many experts in the realms of wellness and well-being and all that. I think me and Dr. G are very much have that commonality. So I'm Dr. Michael Foti. I'm also an osteopathic physician, internal medicine physician by training. Dr. G and I actually trained together, which we're going to talk about today at the Greenwich Hospital, Yale New Haven Health in Greenwich, Connecticut. I'm a full-time faculty professor of clinical professor of internal medicine
Yes.
at the Touro University, specifically the College of Osteopathic Medicine in Middletown, New York. And I'm also an advocate for wellness and well-being and mental health due to my own journeys with mental health, which I'll talk about a bit today. It's been very much a passion of mine, and recently an author of a self-published book titled Grief. Thank you, thank you, thank you. Yeah, which is pretty cool. And Dr. G read it, thankfully, and did not hate it, thankfully.
One
And
sitting. I literally sat down and read it cover to cover.
yeah, well, also it's short, but yeah, it's I made it's short but packs a punch, so to speak, emotionally. So maybe we'll talk about a little bit of that today. And that's it. So that's us. And beyond that, Dr. G and I'm going to call her G for the rest of this podcast for years to come. We're amazing friends among just being colleagues in this wonderful realm of medicine. So again, we met in residency. Our first full shifts being night shifts is where we did that together as interns.
Yeah.
Yeah. Yeah, that was amazing. So we did that, and that's how we became friends, because we literally were just stuck during night shifts waiting to be called to do an admission, and suffered together for those first 2 weeks.
Absolutely. With that like nervous feeling of they're going to call you and the code or RRT and all that stuff.
Yeah, you just had your beeper there waiting to be paged or called, and it was every night for 2 weeks, and it was terrible. But it started an amazing friendship. So, it had its good, you know.
Yes. We
Yeah.
bonded over our Italian heritage.
Yeah, yeah, it was great. It's fantastic. And also G saw me fall asleep multiple
Oh,
times and
remember in the
snore.
doctor's lounge watching that? God only knows what we were watching.
I don't know. I don't remember. I was passed out. But,
Oh, we were watching King of Queens. That's what we were watching
King
at like 4 o'clock in the morning.
those wonderful overnight reruns. That's what
Yes.
we did. Well, the
Mhm.
Doctor Lounge came in handy during that time. But yeah, but we're going to talk about and you know what? Well, let's start with that. It's a good segue. Why go back and forth? One of the topics I had jotted down. I said, "Gee, we got to talk about this." Is and then it'll perfectly segue into kind of my mental health journey. But given that we were interns together, so we were interns. 2019 is when we started, and as everyone knows, spring of 2020, the worst pandemic in 100 years. G and I are, again, still interns at the time. And our hospital, and every hospital in the country, but especially in the Northeast, was thrown into chaos. So, I mean, I think that's what we should start this with, because that is a shared journey of ours. G, what can you recall from that time?
Um, it's hard to believe that that was like almost 5 years ago now. Feels like it was yesterday. So as Mike was saying, we were interns, meaning we were first year in residency. First year, people are calling you doctor. You're just starting to get your feet on the ground, and you're like, okay, by March or by that time, I was on vacation for the 2 weeks. I came back
Yes.
and the hospital was completely different. they were talking about this pandemic, but it still felt like it was far away. Like it hadn't come to our hospital yet. We were getting things in the news. It felt like a movie. I remember they had those conferences, it was almost like like a, what do you call it? Like a press conference in the
Hmm.
auditorium, right in at Greenwich, and we couldn't even be in the room because they were limiting the amount of room.
The town
The
hall
town
type
hall,
meeting.
remember that? And they
Yes,
would
I
have
do.
the ID doctor talking, so the infectious disease doctor talking about what was latest in the news, what information they were getting. I felt like we were in like a sci-fi movie. Like we were listening to these things, like it just didn't feel real. And then all of a sudden, it was like everything flipped. There was like one case. We were in Greenwich, Connecticut, which is close to Westchester, New York. One case of somebody coming out of Manhattan into Westchester. And all of a sudden, our hospital was like full admission after admission. So, as residents, we usually are split in the hospital, split in the clinic, split in the ICU, like all over, and electives and different things. They pulled everybody back into the hospital, restructured the way all our teams were. I don't know I think I was supposed to be on a floor team. I don't even remember, but basically we went from having like three three ICU residents. They doubled the size of our teams, doubled the size of our ICU, all in preparation for this. And it was just kind of like a whirlwind. And we were thrown into it with not much information to go by. What do you
That
remember?
perfectly summarizes it. Yeah. When you were on vacation, I was in the clinic. So we just kept hearing rumblings here and there. People say, oh, this virus, the cases are going up a bit. And everyone started thinking about like the avian flu type thing. And like, those weren't, world shuts down type viruses, but they were big. And we're like, oh, okay, we got to watch out for this in the hospital, et cetera, et cetera. Then we were being told not to wear masks because we were scaring the patients. So then we started hearing that, and then we were told you have to wear masks. So now everyone has to mask up, right? And then yeah, we got the announcement because again I was in clinic that the clinic was shutting down because they needed all of us in the hospital. And yeah, the team restructuring, like you mentioned, I remember that there was one team that was dedicated to everyone who didn't have COVID, and then two other teams that for patients who did have COVID.
Mhm.
But as March rolled on, like February into March, there were no patients being admitted without COVID. So then it wound up just being three teams admitting patients who had COVID, right? So yeah, I think that is a big part of it. And then the other thing that I remembered, and I'll let you talk about it from your so once we're at this peak of this spring 2020, Dr. G, she's in the ICU, I'm on the floors, right? So I really want to get into this, but on the floors, and I've talked about this on other shows that I've been on, and it really felt like a war zone because it was constant emergencies, right? Dr. G mentioned before RRTs, right? So for those who may not know, RRT is a rapid response team. So basically, an emergency in the hospital, right? A patient needs our attention immediately. Now, maybe this differs, but for our hospital pre-COVID, this was maybe once or twice a day, right? On a normal
If
day.
that, if that, right? Sometimes it's a pretty quiet
Sometimes you
hospital,
had none.
right? Sometimes we'd have like
Yes, you're right.
one patient in the ICU, right? Those days. Mhm.
Yeah, yes, 100%. That hasn't happened yet. But now you're talking like peak COVID. We were responding every hour, and I was on the RRT team, right? So I'm talking about like I stopped removing my N95 mask because what was the point? I was going in one room, out of another. I talk about this a little bit in my book, but it was constant going in a room, out of a room, and it's not just that, right? There's two other dimensions to it that really, and I know you saw this too, but the age of the patients. These are patients in their 30s and 40s, right? It just didn't feel real. I've talked about this where, pre-COVID, not that you didn't have your rare cases, but it was a lot of the cases were expected, right? You had your elderly patient who aspirated and they have pneumonia, or you have your 50, 60 something year old who has high blood pressure and high cholesterol. Now they're coming in with heart disease. These things that you've seen over and over again, we're taught to learn as internal medicine physicians. But not a 30 something year old with completely inflamed lungs, sitting on their belly, sweaty. They got a mask on. We're putting a nasal cannula underneath the mask to give them as much oxygen as we can. We're talking about putting them on a ventilator, right? This was every day, all day, right? Having these discussions, right? That is what really wrecked me, at least, where I was coming home every day and like just breaking down in front of my wife. I mean, because it was an immense strain on all of us. I mean, what were you seeing on the ICU side of it?
Yeah. When I read your book, I really realized you were getting into what the experience was like on the floor. And I think in a way it was harder for you and the teams on the floors because you saw these people speaking. You saw them when they came in and they were like, so. And then you saw that progression and they're real, they're people, right? Because you're talking to them and having conversations. And then the next morning you'd come in and they'd be in the ICU intubated. So I was on the other end of them where they were coming to me. And at that point, sometimes they weren't even conscious. We had to intubate them because there was nothing else we could do. They were either going to die or we intubated them. And I know there was a lot of controversy like, oh, we're intubating people and people are dying on the ventilators, but it was either they get intubated or they died. There was no in between. And at that point, where everybody's intubated, everybody's on a ventilator, you get very good at doing critical care medicine, but I do remember like those few where I remember when the husband and wife, like I think you spoke about that in your book, they were across the hall from each other. I remember people not being able to speak to their spouse or, intubating somebody on a call shift. And we called the wife so that they could literally say goodbye. It's like those moments. How do you even process that? Like we had to be there and be there for those people and also be able to be a doctor and like make the decisions, but it destroys you. And there was no time to process it. You just had to keep moving on, moving on.
Yeah. Yeah. No, and I think, it was difficult for all of us. Obviously it was difficult for the families. And when we're not taking anything away from the families, obviously, because I can't imagine, having a family member during that time in the hospital and not being able to see them and not understanding, like, a relative who's only in their 30s or 40s. And we're talking about intubation, like you said, putting someone on a ventilator. So, but we speak about this to highlight, and then this is, I think a good segue into the wellness aspect of this. Physicians and nurses and anyone in the healthcare field, we're affected by this too. We're not robots. It is an immense strain on us, not just the responsibility of taking care of the patient, but witnessing this, having to have those difficult conversations, like you said, having to call a loved one to say, hey, your wife, your husband, or your brother, or whoever is dying and they need to be put on a ventilator, and having to answer that unknowable question, are they going to get off the ventilator? Are they ever going to wake up? These are not easy questions to answer, right? So that highlights, right? My next kind of topic that I want to talk about is health workforce wellness, right? Physician suicide is really on the rise right now. Burnout is on the rise right now. Now, a light is being shed on it, I will say. It is very much a hot button topic at the moment. But it is a growing concern in terms of how are we going to address this at the individual and at the system level. There was, and I want to talk about this specifically. Physician burnout is so high and on the rise right now. There was a study recently of medical students, right? Over two-thirds of those medical students who were surveyed said that they're already thinking about how they're going to pivot away from clinical medicine, and they're not even doctors yet. What
Wow.
do you think about that?
2/3 is a lot. That's a crazy percentage. It's interesting in a culture and kind of a system where we talk about doctor shortages and not having enough doctors, where 2/3 of the people, there's only a certain amount of medical schools, certain amount of residencies are already deciding that they don't want to actually see patients. And it's because it's a lot of things. They see when they go to the hospital and the doctors that are working there are not like they're not, most of them are not happy. They're tired, they're burnt out, they feel like stretched too thin, and they don't have a choice. And then you see people on the outpatient end of it who are seeing patients, primary care or different specialties and working for these big systems where you are obligated and forced by your contract to see anywhere 20, 30 patients in a day. And I know for myself, I went into integrative medicine because I want to get to know my patients. This is important to me. This is what makes me feel fulfilled. And I've had those days where I'll see, up over 20 patients, more than that. And at the end of the day, I feel like my head's spinning because you can't possibly process all the different interactions that you had. You can't possibly do really good medicine when you're seeing patients for like 5 minutes. It's not possible.
That's right. Yeah, I think it's like you highlighted, it's multifactorial, right? So obviously there's a physician shortage, so physicians are being spread thin, especially in the hospital, but also in the outpatient side with seeing patients, right? But I think that highlights that we need to make this more of an appealing profession and
Mhm.
also highlights the competitiveness of getting into this profession. But that so much is hard to tackle, right? But I think that at the individual level, we need to be providing resources for physicians, right? So again, it's a very high stress profession. It's known that chronically elevated levels of stress can lead to mental health disorders. We know this, right? Which basically says burnout can lead to anxiety, can lead to depression, etc. Right? We need to be providing resources at the individual level for our health workforce, meaning not just, oh, you can call this number and you get 6 free sessions of a telehealth therapist. I'm talking about dedicated behavioral health centers at all of our institutions for our physicians, campaigning on mental illness for the workforce. So that if I'm working in that hospital or that outpatient center, I say, "Oh, I'm feeling really stressed to the point that I might feel depressed or I might have an anxiety disorder. I need to speak to someone." And I feel empowered and safe to say, "Yeah, I'm going to go speak to that person and get the help that I need." So I think that's at the individual level. But at the system level, it's tough, right? Because like you mentioned, the being stretched thin in the hospital, in the outpatient center, I was there, I get it, I had 2, 3 rooms running at once, trying to see patients, you have 15-minute visits for patients, that's not proper medicine, and I think that calls to, we need to go back to private practice. We need to go back to these solo practices or small group practices. We can't have these large conglomerates and insurance companies owning physician practices and dictating what we do and how many patients we see
Right.
because they're not physicians, they're not healthcare professionals, right? They're not medical professionals. They don't know how much time a proper visit to A, build trust and rapport with the patient, and then B, actually clinically diagnose them properly needs, how much time you need. And I'll tell you, it's not 15 minutes, right? I think that's not proper patient care, right? We need to go back to dictating this. I mean, what do you think about that?
I couldn't agree more. I couldn't agree more. You touched on it briefly of when we're working in the hospital, having some kind of system or mental health centers. Can you speak to more to the stigma of mental health in physicians and why a lot of physicians won't even reach out if they feel like they're struggling?
Yeah, yeah. I mean, I'll start with my story real quick, but we talked about it. So obviously, you heard us speak about the COVID pandemic. That coupled with the fact that around the same time, as you know, G, but some of the listeners may not know, my mom passed away relatively suddenly to what we found to be stage 4 lung cancer. She died within 2 weeks of diagnosis, and she was 54 years old. Years prior, my dad also passed away, so it was very rough time for me though. And then once we graduated from our residency program, I started manifesting a lot of these symptoms of what turned out to be a pretty severe panic disorder and depression. I was waking up every night as if someone was like sitting on my chest and squeezing my chest and squeezing my left arm off. And it was really the most unbearable sensation. I don't wish it on anyone what I dealt with. And this was for months. And the reason that it carried on for months is that I didn't want to come to grips with what I was dealing with. I felt ashamed. My whole expectation, this highlights that stigma that you mentioned. The whole expectation my entire life was I was going to be a doctor. And I felt, well, why is this happening to me? Why can't I do this? Right. And I felt ashamed. So I started hiding away in my basement, shuttering away from my wife, shuttering away from my son. I could still hear his cries. My son would say, "Daddy, Daddy," and because he was looking for me. And it broke me even more because I was so ashamed. I felt like I couldn't take care of them, couldn't take care of my family, couldn't live up to this expectation of being a doctor. And that I think highlights the stigma of mental health, and not just in medicine, but in general, where if we're dealing with anxiety, we're dealing with depression, we don't see it as another illness. Like if I have a cold or if I have the pneumonia or I broke my arm, right? It's seen almost as a weakness, but it's not, right? I mean, the the consequences of all these stress and experiences that we deal with, the grief and the loss that I suffered, the consequences being mental illness, right? Anxiety and depression, it's part of the human experience, part of being human, right? And so that's the stigma. That's why I suffered in silence for so long. But I'm trying now to empower others to get the help that they need by speaking up and sharing my story, to saying the best thing you can do is get the help that you need, to be there for your profession, but also more importantly, be there for those around you and to be your best you, right? So we need to normalize that mental health is just a normal part of being a human being.
I think you spoke to that
Yeah.
very eloquently. You're it's like you graduate from residency. It's the time you're when you go to write pre-med, then medical school, you're always like, one day when I'm done with training, right? And then you get out of training and you're like, this is not at all what I thought it was going to be like. And I think a lot of doctors feel that way. And then it starts like that guilt trip where you're like, I don't understand. Like I work so hard for this. And this, like, a lot of times it sucks. Like I'm tired. I feel stretched
Mhm.
too thin. The responsibility is, you expect there to be responsibility, but you don't expect it to feel, overwhelming every single day.
Yeah, no, and you're reminding me of something, and I'm sure you know about this, but I have a coach that I speak with to kind of help with my personal professional growth. And one thing we spoke about yesterday is that if happiness is always a goal that's ahead, you're never going to be happy. Happiness has to come from within. Right? It can't be something that, oh, like you just said, I need to get into medical school, then I'll be happy. I'll need to get into residency, then I'll be happy. I need to become an attending, then I'll be happy, right? I need to become a associate professor now, then I'll be happy. Like, no, happiness has to come from within here, right? So you have to think about what your why is, right? What is important to you and what is important for that unique part of yourself, that part of you that is aside from what you do, right? Which is important for us. But I'm a husband, I'm a father, I love to spend time with my family, I love to laugh, I love to make others laugh. Like this is me, right? You know that, right? So that's me, and that you have to really have that self-compassion and love yourself, and that's where happiness comes from within, not from what's ahead, right? So I think you basically highlighted that, and that was what was wrong with me, and that not wrong with me per se, but that was what was wrong in my approach to say is that, which a lot of us in medicine do, is that it's that next
A
step
lot
that's going to make me
in
happy.
medicine or in anything, right? We always think the
Yeah.
next thing that's going to make us happy, whether it's the job or the degree or the car, the house, you can link it to all types of things. And it's a journey that everyone's on at some point, and you learn the lesson and then you get caught up in it again and you're like, oh, no, I shouldn't. Like, you are valuable. Your value is not by what you accomplish. Your value, you are whole just the way you are. Nobody is perfect. Your value is innate and complete now, and you don't need to accomplish anything or do anything to be valuable. The value is already there.
Fantastic. Yeah, perfectly said. Now, I love so much about what Dr. G does, by the way, if everyone knows that. So, uh, I want Dr. G to talk about what she does, integrative medicine, and how'd you find this? I know how you found it, but I want everyone else to know how you found it. Please tell us.
So, a lot of times I'll introduce myself and I'm like, I'm an integrative medicine doctor. And people like nod, but they do that like glaze over where you're like, they definitely don't know what I'm talking about.
It's
So
okay. Now we got to
yeah.
know.
So what I do, so I'm an integrative medicine doctor, and I'll go back to before I even went to medical school. My mom had this like horrible rash that she went to all these different doctors, and they put her on medications, they put her on steroids, everything you can imagine to try to make them go away, and they would get a little better, then get much worse. And they were so bad that she was so itchy, she would just like cry. She didn't know what to do. Nothing
Mm,
was helping. And a
mm,
rash seems like, right? It doesn't seem like much, but if you think about it, imagine you had mosquito bites all over your body and like they would just pop up at any point and they're so itchy and there's nothing you can do that makes them better. So anyway, this was going on for a while. Someone had suggested she see this acupuncturist who literally it's probably an hour and a half without traffic away from our house, like far away.
mm,
So we make the appointment. I go with her. He does like a bunch, he talks to her for like maybe 2 minutes. He takes some information. He puts all these like vials in her hands and he's doing like strength testing and all this stuff. Look like something out of Harry Potter. He's like, okay. He goes, you have too much sulfates in your body. And she's like,
mm,
sulfates? Like, I don't know. And he's like, have you been taking any supplements or anything? She's like, no, not really. He goes, you have like this certain level of sulfates. And then every time you're exposed to something, whether it be in food, whether it be, in the environment, it pushes you over a threshold and you break out in hives. Okay, that sounds great. He's like, we need to do like a few weeks of acupuncture and eat this special diet where you can only have like cauliflower and pasta and absolutely nothing. She does that. They do the
Wow.
acupuncture within a few weeks, significantly better. And then by the end of it, gone. Never came back. As she's thinking about this, because she's like thinking about the thing with the sulfates, she was taking glucosamine sulfate, which is a common supplement that people take for joint, like
Mhm.
months before, but it must have just kept accumulating in her body. Didn't think much about it. So when I went to college, I thought I was going to be an interior designer. That didn't last very long. I ended up switching into pre-med and I was considering going to acupuncture school. I said, whatever this guy is doing, he's literally healing people. Like he's not like putting a band-aid on it. He is healing people. And I want to know more about that. So I went to him, I had a conversation, and he told me, he said, if I would have done anything differently, he said, I would have become an osteopathic physician because you have much more opportunity as a physician doing acupuncture than the inverse. Clearly I took that very seriously. And I have no idea if he understands like the level of seriousness I took that conversation. And I ended up going to osteopathic medical school. And when I was in school, there was a club, an integrative medicine club. And part of the club, they would have different speakers and all this different stuff and explaining what the field of integrative medicine was. I'm like, this is exactly what I want to do. I'm like, this is perfect. So I started learning. And basically, what integrative medicine is bringing together all different healing modalities with the backbone that we're medically trained. Like if you go see an integrative medicine physician, I'm traditionally trained. Like Mike and I went to residency together, internal medicine. I did all the schooling, did all those things. But then I also did a fellowship where I learned more about nutrition, lifestyle, learning more about different healing systems like Ayurveda, traditional Chinese medicine, how things like meditation and yoga play into self care, how the spiritual health is important in your overall health, all these different things. And it's a journey because you can never know everything, right? I'm continuously listening to podcasts, going to different courses. I'm constantly learning just to be able to bring the best value to my patients. And I think I'll leave with the most important thing about it being an integrated medicine doctor is the patient doctor relationship of really having that trust. And I'm not here. Sometimes I literally in the appointments, all I do is we talk and I feel like I'm like a coach where I'm just, understanding their emotions, what's going on, and just having them recognize that, like we said, you're valuable without having to accomplish everything. I know you want to lose 40 pounds, but you are perfect just the way you are. And just understanding all these different things. So it's building that beautiful relationship, which really makes me feel fulfilled and happy when I'm able to do that.
That's amazing. That's amazing. Yeah, and I'll tell you, it's something that I've grown more and more to appreciate through my experiences. Now, not that we've been out of residency that much, that long rather, but I've seen more and more stories now of just highlighting the fact that, conventional or Western medicine, whatever you want to call it, is not enough. It's great and you need it, but there's so much more, right? And I think about an experience I had when I was a student actually. When I was in my fourth year, I was doing a rheumatology elective, and we were seeing a patient who, I believe she had rheumatoid arthritis, but she didn't really like the medication she had to take for it, and so she stopped, and she wound up seeing someone. I don't know what the type of provider she saw, but basically the provider was focusing on basically the gut. I think it's basically the gut in pro-inflammatory kind of axis in terms of, and I'm sure you could speak on this more, but basically how the gut has an effect on inflammation in the body. And through doing all of that, she was complete remission with her RA, rheumatoid arthritis, and didn't need any medications, controlled it completely that way. Can you speak on that a bit about just like the gut and inflammation? Just because I think that's it's really interesting.
Yes, that's an awesome story. It's so cool to hear when actually there is success with doing some of these different things. So the kind of prevailing theory, and I learned more about this through the Institute of Functional Medicine I did during residency. I got a scholarship where they actually paid for the first course for functional medicine during residency. I don't know if you,
Amazing.
yeah, so I was able to do
Yeah.
that. And so they talk a lot about gut health and the prevailing theory of autoimmunity is that an interruption, so basically your gut should be nice and the lining should be nice and solid, let's say, and your immune system should be on the other side and kind of intermix there. so that as we're eating foods that have different pathogens and things on it, our immune system is able to see it, and we kind of have this like balance going on, like so that it's not creating inflammation, you're able to maintain the lining. What happens when we're exposed to very high levels of stress, or we're exposed to toxins? We get like a, let's say, a really bad stomach virus, or we are eating foods. Let's say somebody who has celiac is eating gluten and it's causing a lot of inflammation there. This inflammation that starts out in the gut it affects the gap junctions that hold the cells together. So you should have all these cells that are like nice and tight, um, along the lining, right? And what happens is these like tight junctions have these like little bands that holds them together. The inflammation affects them and they start to break apart. And when you have what they call leaky gut, but the actual term for it is increased intestinal permeability, you end up, your immune system is now responding to, it's getting exposed to all the foods and different things that you're eating.
Mm,
And then
hmm.
this exposure to all the different foods is creating antibodies, but the antibodies are not just in the gut, they're floating all over your body. And what are they attaching to? Oh, this kind of looks like a thyroid, and this kind of looks like your joints, and this kind of looks like your colon or whatever it is. And then that's the theory of autoimmunity. So the theory of treating that is, if we can treat the gut, remove anything that's creating this inflammation, give back nutrients or whatever it needs to heal the gut so that the lining, the integrity of the lining gets better. The antibodies only have like anywhere from like a 30 to 90-day life. So they'll kind of peter out. And if you're not constantly being re-exposed to those things that are creating the inflammation in your body will get significantly better.
Wow. And at least from the physician side, I know, I mean, and I hope others could understand that, but I think that you explained it extremely well, and I understood that it's basically just exposure of your immune system to so many things and leading to these antibodies. That's really interesting. And it speaks to kind of the tenet of osteopathy. The body has an inherent tendency to heal itself, right? So you're basically just using what your own body has to heal itself without having, instead of suppressing the immune system with these medications, you're just letting your body do its thing and stopping. It's like stopping it at when there's a hole in the dam, just plugging that as opposed to, trying to do something else or just fix it at the root cause. It's really, not that we're telling everyone with autoimmune disease to stop your medications. I'm just saying, we're not saying that, but we're, just showing that there's so many more things that we need to know and learn about diseases in general, right?
And they're not mutually exclusive. And that's what I tell my patients too. It doesn't mean you stop all your medications, but if there's something you could also be doing in addition to your medications, maybe we could lower them eventually. Maybe we can, and that gives me such satisfaction. I see it even with my diabetic patients when we can start pulling back on the medication. Like, you were on insulin, now you're not on insulin and you're only on pills. Like, that's huge. Those are things to be celebrated because it means that your body is starting to heal and changes are happening. And that makes me very excited.
Yeah. So it highlights that there's more than medicine. Medicine is needed, but if we could figure out other things and learn more and more about the body and how it works, and then allow a physician such as yourself to peel back some of those medications, yeah, I mean, I'd be all for it. So
It
the minute
starts
something
with
happens to me, I'm going
lifestyle
to see
stuff.
Dr. G.
It starts with the hard,
Yeah.
I wouldn't say the hard stuff, definitely not complicated, but exercise, looking at your diet, getting enough sunlight, sleep, stress, like all those things. I think sometimes I work in an endocrinology practice, people will come to see me and they're like, I want to lose weight. And I'm like, how are you sleeping? How are your bowel movements? And they're like, what is this girl asking me? But that's where it starts. Very important.
No, it makes sense. It makes sense. That's amazing. You're doing amazing work, Dr. G. I tell you that. That's great. Your patients are very lucky. That's great. Um, so we're almost getting towards the end of this. I wanted to quickly wrap up by talking about, you've been having very much and then I'm going to talk about a little bit about my book and then we'll kind of end it there. But uh, you've been growing a nice social media presence. I love your videos. If you don't follow Dr. G, please tell us about how they can follow you. And just tell us about what you've been talking about on Insta.
Thank you for highlighting my social media platform. I knew, so if you want to follow me, it is Dr. spell it DOCTOR period, and then Gina Marie. That's my handle on Instagram. I don't know if you remember, I actually started posting things way back before, it was right before the pandemic happened. I think were we on that? I think we were on another night shift together where I was sitting in the ICU. Do you remember I was like making my website and all that stuff?
Yeah,
Wow, my gosh.
yeah,
But then
I do remember
obviously
that.
the pandemic happened. I knew that it
Yeah.
was important to have a social media presence as a physician, as somebody who I have all this information, I'm constantly learning to be able to share it, was very important to me. So some of the things that I've
Mhm.
been posting about, something I'm very passionate about is women's health, um, specifically around like periods and difficult periods. I see a lot of women who come to me, they're either on birth control, they want to come off of birth control, and they're interested in just what can I do to support my body going through this natural process. So I've been exploring a lot of different things that I've learned through there. I'm also interested in obviously nutrition, lifestyle, building muscle. I tell all my patients to go lift heavy things and how important that is for longevity. Those are some of the things that I've been sharing. Basically, as I'm learning stuff, and that's the health stuff, but also also have a coach. I'm in a development. I'm working on a business, doing all these things. I like to share those things too because it's important that when you are active on social media that people see you're not perfect. Like none of us are perfect. We're working at it on the back end. We have good days, we have bad days, and that's what's really important to me. So join me on my journey. A lot of fun stuff that we're doing will continue to grow.
Definitely join Dr. Gina Marie on her journey. Yeah, I love all your videos. So it's great. It's life is a lifelong learning, right? I mean, so I love that you're learning things and then sharing it with us, so we get to learn more. We're just all teaching each other. I think it's phenomenal. So yeah, so definitely bring that here too, so we can always continue to learn. But yeah, so follow Dr. Gina Marie on her Insta. I'm on LinkedIn, Michael Foti Do. That's my primary kind of social where I do posts and whatnot. If you'd like, we talked about this, but here's my book, Grief. It's on Amazon and Barnes and Noble. Would love if you read it and let me know what you thought. But yeah, this has been the first episode of the Upward Spiral podcast. This
We
is
did
going to be
it.
great.
We did it.
We did it.
Great. And
Yeah. So we're going to have guests.
amazing
No, go
guests.
ahead. Please tell me.
Amazing guest.
Yeah.
What you don't
Yeah.
know, Dr. Foti is the master networker, and we already have guests lined up before we even had anything together. We're going to have some incredible people, incredible physicians, people in general. That's going to be very inspiring, and I'm so excited.
Yeah. Yeah. Listen, I'm trying. But yeah, no, guests are coming. They're already lined up and scheduled. And so it's not just going to be Dr. G and I, even though I think we make a good duo, just us for an episode or so. Yeah, and that's actually going to happen. I just as we are going to bring a lot of guests on the show. There's going to be episodes where it will be just us because we'll arise where we say, let's just talk about this and let's get an episode out there. So look out for that, and hopefully this journey continues. This is great.
Absolutely. Thank you for
Yeah,
your time, Dr. Foti. This has been fun. Until next time.
you
We're
as well,
getting
Dr.
a
G.
tagline. We need something at the end, like until next time, your favorite doctors.
Why don't we just do that? That's
Yes.
it. I like that. All right. Thank you, everyone. See you on episode 2.